Last. Now everybody go to breakfast.
Hi friends, welcome back. If you're new here, my name is Emma. I am a 31-year-old pediatric hemonc and BMT nurse, but right now I am currently not working. I did take a summer camp RN position, but that doesn't start until the end of May. I go grab a coffee or a matcha from this. It's new to me, but I don't think it's a new place. It's called Daydreamer Cafe. It's by the University of Florida. I'm probably going to be literally the oldest person in this cafe, but the vibes are immaculate. I just keep looking on Instagram. So we're gonna go grab that. I'm gonna come back and we're gonna chit chat. I got my matcha. Look how gorgeous. Gorgeous it is. It's a blueberry oat milk matcha. I just now started getting into drinking matcha. I'm just drinking coffee lately just really hasn't done it for me. I want to go dive a little bit deeper into what it is to be a pediatric hemonc RN. I went into pediatric hemonc because I wanted to change someone's life. I knew that these kids basically kind of like their new normal of life is basically living in the hospital, and I wanted to change their life even if it was for one shift, several shifts. But it turns out they changed my life completely. Their families changed my life, the kids changed my life. Personally, I think that this is one of the most challenging specialties that anyone can go into as a nurse, but it is the most rewarding. I'd love to say that it is the hardest job that you'll ever love. So let's dive in, you guys. And yeah, I am actually this weird, so. What exactly is pediatric hemonc? I also did BMT. Not every unit has a bone marrow transplant. Hematology. It's hematology and oncology. Hematology, we see kiddos with sickle cell, hemophilia. Oncology, obviously, it is cancer. So we see kids from leukemia, lymphomas, brain tumors, bone cancer such as osteosarcoma. We see kids all the way from being a newborn all the way till 21, taking care of adults that have relapsed with their cancers. Some of these kids that we see are newly diagnosed. Some of these kids we have seen for months to years. The most important thing about our job is that we meet these kids and their families right exactly where they're at, emotionally, spiritually, and physically. A normal day on a hemonc unit, it kind of varies. So working in hemonc, you can either work in an infusion center and you then are still giving chemos, you're doing blood transfusions, platelet transfusions, getting their labs. What does a typical day look like on a hemonc unit? It definitely varies, especially on the acuity of the kids that you are taking care of. I was working day shift. Day shift, I come in, get my report from the night shift nurse. I always make sure that I'm getting their diagnosis, if they're getting chemo, their chemo regimen, their labs. I think the labs are like the most important thing because I want to know if I'm giving blood or platelets like at the beginning of my shift, or if I'm giving chemo, or if I need to make sure that I'm, properly hydrating them before giving chemo. Eventually you get to the point working on hemonc that you know your kids because you have like the same kids all the time. Sickle cell kids have pain crisis, and a lot of them usually are on a morphine PCA, and pain control is one of the most important things when a child who has sickle cell is coming in with a pain crisis. Even with our oncology kids, making sure that they are not in pain. Some of the bone cancers, a lot of those like Ewing's and osteosarcoma, they are in a lot of pain. Or if you have kids that are getting chemo and they have mucositis, a lot of kids end up on a morphine PCA for that because the mucositis is so bad, and the mucositis can go from the mouth all the way down. So it is very important that we are making sure that these kids are super comfortable between pain, antiemetics, their nausea and vomiting. All the kids have central line. So they either have a PICC line, have ports, or they have a double Hickman, which are my favorite. Having a central line is one of the biggest infection risks to these kids. You don't want them to become septic because we're not properly cleaning it, we're not properly using it. The reason why they have these central lines is because we are administering chemo to them, and they do need that. We're giving blood platelets, monitoring for life-threatening side effects from the chemos, fever, neutropenic. You know, they basically have no immune system, and helping with pain and nausea. And sometimes these kids can stay on the unit for months. We are also preparing them for LPs or surgeries that they might have. On top of it just being physical care, there is a lot of emotional care that comes into play. I mean, think about it. You are taking care of a child. Most children don't even like to take medicine, and these kids have multiple medicines to take. I'm not going to sugarcoat it. Pediatric Hemonc is very heavy at times. You build really deep relationships with these families and these kids. We are celebrating every clear scan, every birthday, every remission, every end of treatment. Doesn't mean that there are sad times on that unit. There are times when things don't go as we hope. Those are some of the hardest shifts to go into. You grieve when one of them passes away. Something that I have learned too, that like I can't always take my work home with me. It like consumes me a little bit. So not saying that it's a bad thing, but also like you eventually like will learn that you need to separate work and home. As much as you love the kids, you got to learn how to do that. It can be very heavy working in Hemonc. These kids are such fighters, and they are funny, and they are wise beyond their years. They will dance through the halls with their IV poles. They will get up every morning. They don't ever complain about anything. They find the joy in the darkest moments. And I think that is like one of the hard things as an adult, is trying to find joy in dark times. But yet they always find the joy. And if you're thinking about going into Peds Hemonc, there are so many things, like traits that I feel like you kind of need in order to thrive on a Hemonc unit. Is emotional endurance. You have to be able to hold a space for grief and fear and hope on the same day. All in the same day. If you can't do that, Hemonc's probably not for you. You have to have incredible attention to detail. There's no time for error. If you mess up, it can be life-threatening. You gotta have good communication skills. It doesn't even matter if you're going into Hemonc. Like, you gotta know how to talk to people. You have to be able to advocate for your patients. About communication, on top of just communicating with your coworkers and doctors, you have to be able to communicate with the family and the child. You know, you're giving chemo. Most kids don't know what chemo is. Family members really don't know what chemo is. As nurses, we're taught to talk a certain way, but not talk medical, you know? Like, we're all human at the end of the day. Like, talk to them like they're a normal person. You gotta have compassion. Of the emotional endurance, I think compassion is one of the biggest things. These kids need to feel safe. The family needs to feel safe. You know, a lot of people ask me, oh, how can you be a Peds Hemonc nurse? Like, it must be so sad. It's also such a rewarding job. I don't even think twice about it. It doesn't even feel like a job to me. Yeah, I mean, every day you're gonna sometimes feel like, oh, I don't wanna go to work. There's so much love on those units. To be a part of a child and their family's journey, even if it's for a short period of time. So inspiring to see these kids. There are so many times when you are working that do your nursing stuff, you know, your assessments and your charting and you're administering your meds. And I feel like these kids have taught me that it's not about winning or losing. It's important to be present in life, showing up when it matters the most. And if you know that, then I think everything in life is just meh. It's just meh. This video is definitely dedicated to all the little warriors out there and their families. And I hope you guys feel seen and heard. If you want to hear anything more about Peds Hemonc, you are in the right place. Comment down below, follow and subscribe. Thank you for watching. Until next time, I hope you guys feel seen today. Bye.